Why is this important? Again, this is totally preaching to the choir. We know that the faster we get good antimicrobial or antifungal therapy, the better these patients do. And that data is really compelling from lots and lots of places. It's not my place to re-educate you on that because you know that very well. But just a couple things. I mean, that you couldn't draw a more linear mortality curve. The longer you wait, the worse you do with antifungals. In patients that have sepsis, all of the surviving sepsis and goal-directed therapy literature over and over and over again shows that if we get those antibiotics on faster, those patients do better. And those top 5 pathogens that we're looking for are E. coli, Staph, Klebsiella, Enterococcus, Pseudomonas, that we can now, I think, much faster than culture data get this back. So the T2MR platform, which Raul, I think, can answer questions in a little bit later, can get these diagnoses, this bacterial, which is in development and almost ready for prime time, can get these big 6 bacteria in 5.5 hours. And so you have results very quickly that you're not going to get with blood culture, you're not going to get with all the ID testing, and you have actionable intelligence while that patient's still in the emergency department or as they're hitting the door of the ICU. And then that extends to every part of the hospital. I see these patients everywhere as a surgeon because I get called to consult on them everywhere from the primary care physician's office to interop problems to the ICU, and certainly a ton through the emergency department. And here's the question, do they have it or don't they? That is the question that I always want to know, and we are flying blind, and I think we can do better.